Do you want to be a professional driver? If yes, worry no more. Send Driving, the finest among all, is here to turn you into a first-class professional driver. We are the Gambia's numero uno solution when it comes to driving. Send Driving. We offer top-notch and affordable services that cannot be found anywhere. Rush now and start getting your lessons from our competent tutors. Send Driving. Our services include 1 week driving lesson, 1 hour each day for just $3,300 with a provisional driving license, 2 weeks driving lesson for just $5,000, 3 weeks for $8,000, 4 weeks for $12,000, and 5 weeks for just $13,000 with a provisional driving license. We are located at Tabokoto, opposite Piccadilly Junction. Send Driving, your success to safe driving.
Yaye money transfer ilelanna yata itole sono yata kododunni yaki te koduna karobela banko karobela katom kokoina benyindulala UK ning Ireland Europe kata Africa aning America na office oli benyindulala serekunda woni talinding tabo koto woni mbusumbala burusubi kata bagote tujereng woni na kunju katong kata basi birika maba kata fokerewan para feki kata fokawu alisala kodota GT bankolito woni mfana Dross bankolito it cash power go fanan kali yenne mobile topo go fanan kali yenne iredi go bata woni ndibo banta ni la vida lonna fana yaye ka kenyaming ibunyin julola yaye ka keten ifele www.yaye.co.uk waranto ise bunno julola +440208519007 waranto 0793095706 and mfanang ila customer care amimbe America ise bunno julola 001781215377 yaye nyulelane instant yaye money transfer
jiber lawe dawda drong ngalu konto ngalu jia alla programme to Ifang Bondi alnal badi malo Modou Lamin Jamme binni membi jan drong wole keta Mr. Modou Njie ti Director Health Promotion Mr. Njie ngeji Ifang Bondi to
abaraka bake Modou Lamin Jamme kontanta baga pour inba jam to kana jam
okay Njie kachani mbata la ko male naina
abela
follow mbada dila dam wole ndiko Gambia health system is one of the weakest and one of the poorest in Africa. Mineni sabu
Modou Lamin bo fanan fole ko niko one of the weakest, one of the poorest manso kumola nyaje mansong niko jade kende Africa jan niko Africa jan ha mfada be nyatol de because nyaji be killing nga follow dam to kabiri safu ko primary health care nga commencé banko ko 1980 otumata leptano mansia otumata hospital safu fulada malo wala mo FSTH and Bansang Hospital Tata the primary health care system was the best in Africa 1980 1985 because one ngamune ke ngaje ko sato wo sate nim mobe bolaje pour que dal leptano to amanya na tamala min kata fo kilometer lulu radius of 5 kilometers amanya tambilala adu no sabatin le ngaje ko wala una help post also na village health service system also mi anko nga sieke non soto mi anko nge karandi wala ka village health worker supervise wala ka traditional birth attendant otumo wala call supervise ba sawo traditional birth attendant ngol fanam falinde ko de ngel do ko falene otumo ka timmu do ga sa to kono ni mo futatema e man mi manan kunno ya tambinde atal tan otumo system mo betata bak adu ngawo improve le otumo ni ajibe village health worker be caring nyaji be gambe jang sate mumboro sate wuli fula and feng because nyaji be 1998 communities tala wuli fulo ma sign wotumo sate tansaba safo tan nani fo talulu wol damale safo ko wolle village health worker soto bar sa nyaji be o satol be kono ntaro fo sign binanna satol banna ka nyaji be o sate wuli kilo ni anin keme konon ne feng almost sign sare tan konon keme konon to anin talulu ngo soto mi ko futata o temmo mala wala mo village health worker mi ko nge karandi adin musol mi ango fanan walla ka nunto ka timu to ba sai ko timu to e ka muneke ka musol ya marla nin kono bela yenda dal le pando wato minna yenda fana ni beta wul wala fana yenda mum bagage le futale makke pam to poto nyami ani ka mol ya maro ke pukatal le plan ka no stake juna ya doko timato ka ba oto mo wal manta keren salbe keri nga second school soto no 1981 wadda malam ko seten o community health worker wo ko dama karande wotumo say nga wo soto fo say nga mol karande non ko da kema fula kema wala mo kema fula ngo karande sama kono misal fe baj fula be kata nyora sinaki ne o yiri wallet SCN school be bansang abe yiri waka luwolo akuma sa mo ne lulu mo tansaba say wo kaminta sama kono mo kata mo kemen talulu ikamen karande University fana be keren sai UTG School of Nursing side public health side medicine side ado medicine fana yirwata for specialist training from be ko surgeon side so de ko nasita koma wala na ngay fo ko man nasu ko be nyaatol
okay Njie wati soto tan Senegal ka bonan Senegal le na jaralu ni Gambia bul isonda
an sabe keren
bari sign momen ka bo jankata Senegal pour ka jara do ni Senegal bu wala tambita dan Senegal men ka bonan Senegal kana ka jara do ni jang iten inte yalo ne ko comme Gambia health system ani Senegal ta ite la isonda
okay
isonda jira ngana I want to ask a follow up question you want to tell me ko are you trying to tell me ko Gambia health system is better than Senegal ta
niaji different categories lo
Memena, are you trying to tell me are you trying to tell me Gambia health system is better than Senegal ta?
Senegal advanced santé niko jade kendala karola because niaji be mum fotam person do be mem ke bonu janke sama Senegal jorongal be bul especially sol soto wala nan to fanan ko ngada ko sayen kam mol ki wato wadi kata Senegal mais mo nekken la pour ko kam ka balan wala mun ka ma jorongal soto adu ngal le tanon soro adu fana ngamol fana so miango wala karanta wala specialist so adu soro kan sai nun to specialist man to ngia mfon kibanon lamu wala seriano
bari nun to no Senegal kana janne kana jaralo la jang so sai hay kana jaralo la jang
ko be nyami mol ka fo nyami wonte de
so sai to lamul ka bo
ko indi de
okay ako indiana
ni be boda sato man ko kata boda dan nawol ni nga clinique ko soro misal fe be exemple di la ni ko Kisama Jaw for example nin no so bota kunta itara no clinic la Kisama Jaw ni danda na sato min be Senegal sare fonkal no to nyaade bide Kisama Jaw no so binata Kisama Jaw wala bita bali hal hawa be bodal to isa ni o lungo long isda jaralo ngine je to mo jamana kana na no sky to ngini ika boro ko wolta pour kan boro so tala o bu pour le ngam mum fo boda da nawla o be ken han sign nun to asiata han sabe keren because na service on yajibe immunization service to nyale fana mbaka mo charge bari fana mbaka mo charge bari yajibe control service nga suta ne molla nyaming to mondo to la service le ka tamu la jank ta le panot so to la service so suta ning misal fe boda dan misal be ke jen jokado nga example men dila ni be ke jen ni boda je kata Senegal so to la mol fana kata clinique la ke jen ye bo kunta ta ke jen ni ta kunta ta ke jen automatically mol kal no to dan na sado fonga no to na bi mu no se wati kar abekala keljen
let me come in there
so sa but especially so le karola
ha
wo statistique fonga singa fo ko ni statistique kar ni wati kar mo nangam le boda gambe jam pour ka yaralo ko Senegal
no we don't need to look at statistics for that
no
I understand no yalla mi anan ko we don't need to look at statistics
okay
yalla mi anan it's evident is clear and is out there for me, you and others to see. Senegal jang nindol korta ko kula jang kata Senegal.
Ha, we gel hanko gol fote.
Ye specialist min sort of mo sort of Gambia jang. Ye masingol min sort of mo sort of Gambia jang madungana.
Ila sajibe Dakar da
madungana ha.
How many million people?
No madungana.
Dakar da madama.
Madungana.
So don't worry about 2 million.
Okay, I'm coming.
Now I'm just giving you one example.
Okay.
You know, ila advanced country mpanambe taka wor fanandola. But nento fanani Senegal compare in terms of jarakena karola. Itol fanan ininna mol fanan kata doko kono janne. Man fo fanan kullo.
Okay, madungana just allow me. I want to ask a question.
Communicate a person also in the mall doctor ni Gambia ni Senegal communicate. They are trying to transfer skills to each other. Okay. Na mol ke ikawandile ifanka na mol fanan kawan.
Okay. What I'm trying to put across here is Gambia no min kara Senegal ka jaralo nyini je surtout nanada kurangol na meli alan ko kansanyol sifalu anin kudolo is too much.
Cancer is a problem.
Asiata bake Senegal kara jaralo adum be ko min ngamin foy non komando nun to ni tol kana nan jande ka jaralo nyini tol bul bi ay aketa tanya do sen ko modi ndol kata ka jaralo nyini Senegal bul. So now modunga I just allow me to ask a question. So sign Gambia man sakunda be muneke kam pour ka je ko dandula e taranyinna be muneke kam
yala wala na ngofo na ka kuma wato ngoko fanga specialist school surgeon UTG. We have a specialist training school because more doctoral training on different specialties. We have oncology, pediatrics, so many of them. So obe caring right or training starter government was started at the UTG. Omu kuleti mi anko nya bo kubala wati. Modo kaba banko do kansa wala kana karan o karanjan. Omu ala tentol dara kendara karo. Joran fanan be expand kan ami AFST yajila be dami. Emergency side Ibadan vet kan. Abi bana don vet la don ala joran be sontal. Tumando saying right now be service min kekan be kekan ndeman clinic la. Mbe bakaw. Baro fanan soda joran minna wal fanan be comme ibena kanan domon dolbe jël order but this special point dafa para maintenance be banda o mu couleur mi anko o be sotla adu ñaaji be fanan no sol fana karola SN school na badge flash radio mi anko ibe karanka ñola signa kile 100 SN school for the same thing wal bana dawda staff to collect problem.
Yeah, let me cut you there. The same language. Albola for far too long. For many years. The same language. You come in for Jambi. The same language. You come in for Jambi. You joran kare kanale. Still things are the same. Problem in the health sector to Atibana. Let me come there. Okay, let me come there. I will give you one by one.
Okay.
Nimon sonjela sansilang. Problem on be treat la one by one. Killing. Okay, very good. Force. Ngaje janne ko komi musolu. Ni tata tingoto. Ikabataje bake jama ka fa tingoto. Gambia kono jang o manke kunu kundindi. Muli ya kumbo, muli ya kumofo, muli ya ku kacha, hani bi kese mambo jabado. This is a problem that we are having. Gambia man sakunda be muneke kanyendo.
Abaraka baraka. Adun lafte murun la komo ko ya murun nun komo la. Tumon na mortality ratio 433. Tale yolan isonta wala. But as of 2019-2020 we have about 289. 433 289 mala siata sultan mala siata.
Yeah. These are figures. Many along people are critics are disregarding these figures.
No. Don't want science man because they are not without figures.
Ha.
But left them ko ndema don. Abe talakan ma fa man tara kering. Mol ka parti motole. Amandia docteur, amandia nurse, yaji ko la patient men ko na be kurkuru kan kabisa fa aduntan no pour ka register ANC antenatal clinic pour ka register wala. Ina ñoo kurkurale ñoo nenal ñoo ne fayta fabilaren tingo da puka wulu ay bang ani ka wara no spuka la fara docteur buka la fara ani akay ne ko yale naka da fanan wato dol jama min ko sabu le tardo fanan ka asabu la tardo ni momon futa leptando juna
getting to somewhere
min mo futa lieutenant juna inda futa juna amon futa juna man to dol be je men ko inda kala yenda jela juna o buga keno nim mo fana men ka ma de gista juna pour kata nos kata juna o fana yemu ya fu karagolo yiri giseta nos a katra yenda itagenda jibaro min so yenda makol min sotla non o beta sotnona waro do fana yelo fana se mankino ala ni mo yelo mankita ala nabe wulu fasi solo yelo la o yelo fana nim mo man soto memba yelo dilala o fana se ke mantora kuti bugo ni ajibe jang ite sultan ni ko ta yelo di jama jega ko mal jibe fan jibe ko he bante yelo man sia bar jama nim mun kata mun ka mol escort le tanato jama akake muske ba ko toledi wala mole mianko ate muso metu rata mako no min be kata jama
so do you expect ja non kana I want to put a follow up question no you will come I want to put a follow you want to tell me go you expect someone me mo bonni nan timutala mo bonni nan suwo kono pour ka escort ay futa le tano do fana mari mako je pra wudu is that the responsibility of that person
escort amanga ko bangenta ka mako escort ni futa ko kare ayenta yelo sotola misal fe ayenta yelo sotola ni yelo mi anko yegini ka fote bi yelo dino la bang isaya mali sago he de yelo dino la ntama yelo mansia bayte mali taw na fo yelo sala fa mansia
but what is the government doing about this
blood bank bi jela don't know on Ministry of Health but every hospital there's a blood bank
but there are problems revolving around these blood banks.
How many people are transfused?
Okay,
how many people are transfused?
Our health service is good. I'll drag you back a little bit.
No problem.
In other countries, akatara jeli ready-made.
Yeah.
In the West, you have traveled all around the world.
Yeah, that's
in the West, certain things kaken dolla leptano do nana da musukono man la kuldo. Those are avoidable.
But those
are avoidable. Not only blood bank. Yala war is one of the problems.
Yes. No.
You understand? I'm coming.
What I want to add is malnutrition is also another factor. Anemia. Tonyala ni musukono ma musukono bala. Ayenta domoro le domola. Mimba makwela. Ni o domora bikyo domo amam makoro so mimba makolo to yelo doyata wala batna yelo ngata la fala. Omu kuklinati. Adon wala nan ko makoro mafu commune doyata ya mako ya made samba la rangoto ya mako hani de mo fode. Iba makolo domoro do kabya kono kuma asbato minna fo jannabe wulula. Ya mako fanan kayto na ni wulu wado sa programme le tando yalla fonol be pakay. Bad preparedness. O kumata bakele. Ba jama ke munyal don tinga ma don pour ko nga ko da ata fango do ni no so tale ngi ka don ale samana na ani ma samana ye boring to nyaato nya lafta mina don to nyalam mo sira bon ka banti ngoto amandia jada kenda bundaay amandia mo jada kenda bunda kon ba minam promote don fon ka wan do ka na ka wan do ka dimmi ka wala mu muskona ma ni yalla ni sobita ko kono bela ka wo karsa bo kono yenta wulla kata ba geta lefa yere gesta
Njie, let me come there, Njie. Will you agree with Nico? Gambia la jata kende ya bunda. Amantara taka nyato, and this is one of the reasons. Meya atina, musu jama abide ka bantino. Saya mu alal pool. Nade ko membe kela obe kela. But saya do fanam bije, what is avoidable. So, but this is as a result of the poor healthcare system. Membije, wale atinda muso dol bije kafa. Ikafa tingoto.
Okay.
If you agree with me, we will continue. If you don't agree with me, we will still push on.
No problem. Nda so nema. Because mina munga fo en kabin dewa. Nko ko maternal mortality. Muso la bango tingoto ay factor jamal la soto. There are so many surrounding factors. No friend. If you go for Guinness in Musobanda Tingon, if you go for no, because condition Jaman Lekatala Kunato. Well, and no be Bondi don't go. Yella Manco be killing. Fulanjam, de Muso Taral Tarde Kafuda Leptana Juna. Obejela. To one name tablogan to Lacro, Missalva Carifa, Bon Safoko, Sena Mol blame wala. But wo na molke haklo to back the sign kaje ko nimmo na ka yalon ko ma manage no the next level then the carry fight all level.
Yes, now you are denying, so I will push you kono be musundi wala afutala leptano do anyanta bola moto kono wato menna that attention wasn't given to her for musundi banda That happened in Banjul. Musundingo nying watu janita musundingo tu banda.
Okay.
Inyanda dun la puruka service di ala manke. Okay. Sometimes there are certain situations meli alonko musu kono mal ka futaje. Inyanta service wo men nyanta dilela abuka dila. Service wo men nyanta dilela abuka dila is out there and is visible for all to see. Mansa kunda be muneke ka nying kajeko musu kono mal ni futata quality service ye dila. Doctor wol ni no so la do ko nyanta datila dame. Problem kana soto.
Yala ngo fo en ko mansa kunda dale kenda bunda karola. E ka muneko don ka mol karande. Kela londo la fa. Kajeko joran fo ne soto. Kajeko dal fo na mi ko jadda ke la fa. Do expansion on ko la fo en ko be ke invested. An le tan jambi jem bo ke ka wodo. Bi ka man da dal ni bol be jara jara. Lafta min nim mo mota le tan de sola min ya soto. Ado be keren. Ma kata kan ala be keren. Bare man sakuna lo labinde wala kaje ko joran le soto. Boro le soto. Ado mol fana mi ko le kata do ko nyum fana kono. Ila londo fana yirwa ado e sia fana. Ado be keren karando be keren ala ngo karando fana fo en. Man sakonko ban sang SN SRN school e bebe karando ke kan kaje ko mol min do tata dole mo be kana mo comme da ba karando na be ke kan do fana katale kata hage do ngini da do bantala bankol kan do fana kata wala ne mo man siya aka barandro fana ke o karando fana be ke kan bare fana na system bi daka nyami ni ko wani nunto compare la nunto in the 80s in the 90s to nyalo improvement o katale adu mol fana adu lefta fole fana ko modol men ka non lefta no to e ke inka fana ka rapid assessment no kele e ka wala no satisfaction service mol fana ka bi tane wala mi ka content back na service wala le one of them years ago months ago nga moy bundum matana hospital mo be ka bo brikama ka tarje minomu service will improve tajel likewise farafenye na RCH likewise Soma likewise Bansang RCH Basse RCH molka interest la puka dan leptanol to minomu because na quality service ko le provide adu na staff ngi train in a way that ko e ka mol approach nyaming ayatin na mol ben na service or appreciate kan ay ba appreciate kan
but Allah staff so dol bije Allah staff so dol bije ha mad ngana ya let me come yeah let me just allow me to come yeah allow me to come there patient dol ko sasa e kanana leptano ni natana to kulal mel ka taraje mel yalon ko la responsibility lom pour ka je ko patient toning I treat with all respect and dignity. In fact, special treatment yedi ala bari molo me alon ka sa cha. Bari ka diamu patient to le nyame. E ka manya men ke kan. Mo manya na kelo mo manya na o kela sa to kan.
No, that's true.
Doctor o dol bije o daji kol bela no so dol bije o daji kol bela leptanol. Albe mu ne ke kan pour ka je ko daji kol me alon ko daji ka jawol lon ye dang leptanol.
Okay. O kulul la kala waka.
Bari amro kululol man dasa. Yeah. Because wol ka kele hani bibe ke kan.
Kulul ka kaya.
Wolka kele bari amero kurulol le man dasa bang wala nyinen karoti because wolka kele hani bibe keka
no kulula ba kunna dola yala
bari hani biya ka kele
yala group a bete ma bejele kuruma beje o kurun kilo ni domani ma roni wala ka mo be to kuya ado mota fla modo beje mengo e ka mum fade mol bu ko ga modo ka kele mo so wala modo ka kele dol da ko bolo nyama ita fale nola bari sa mune kano wala mkaje ko kabulo na mkakulo da kan kay busa suspension be ka ko konal ado atina fan sa nay RBF programme ñu abele tan beto resource based financing e kam be fota nin ko la ko la da moko na report of taraje yalla ko le tan ñu ka penalize le ni ñanda fen soto la misali ne 50000 soto la e do ka da 5000 ko fram e ke penalize fon ka lon ko to nya na daji ka kare wala nga ku kare nga minke wala atna mboyta so mo be ke hakil to sign hakil to bala boku na to sign so buka diam mo ka person ka nyama sign abe kola ba ka project clean bolo je de man ting nsam fo nta ngo lahi do dila buga minamu yalla ko kulo ba kunna to clean fula nyam fo ya je ko ye karan le ko ite man na mala mo ka nyama ila karan do ka bo college ka bo training school men ko be ta dan ngel yike karan ni wala le yo lon ne ko diti fana ikam min kata newo ke mod ni modo fana ko marla to diale mari fana yo lon ne bari nga fo nyamin dron every society mo kendo be jele mo ko rumbe je o mo ko rum fana wala ka kudo fanan kolani ba to nyato nyambe mun fo kan service ol improve tabaka adu ngana service fanan kono da kono nga kono fanan da baki
okay
na service
kala service ol improve ngata be problème ol le jibe kanja nga sound blado
bala ka ba ngene ka promote de
hani no
wala do fanan na ko mi ango ngeke ko be do fanan fanan be si fo
me vive koronto de
hani
jadi be ko be do jibe le ka problème ol folo jibe na solution o
kaja
kaja
ninde mo de ka fo ko be do le fo na le bon
yena solution o kaja no itela ko nyeko health system o is good abita ka nyama I'm trying to show you ko there are problems that should be tackled
no problem
yalon kaja ni adeta blado aha wala ka dia nyanga song bar ni balanda me nyode de la jad Njie ya kalam tale ko comme Gambia bi la leptan ba Edward Francis Small Teaching Hospital ya kalam tale ko jiku am problem balti
okay ninga fem foje me fanya pole because EFSTH is a semi-autonomous body. They have their own PRO, the information officer bebe jail. What information among Pudantama? Ma kalamuta, ndefem fono je. But mba find out I get back to you. Wallahi. That information mba mo wala. Ngana ko jio okumada let not open up that jail come for day. No sir. No, I'm not sure. I'll find out.
Njie
I'll find out.
Njie
No yala mina mkamu for day.
ngana Njie
They have their PRO.
I will respect the fact ko come no.
That's the truth.
Forget about the issue of PR. Forget about the issue of PR. Ngalon ko kuja mabe banko kanya nana da jata kende ala bundal. Obela tablo ka.
Wala na ngaw fo.
Ya famia.
Umon fo na tablo kan.
Okay, problem tije.
Mba fana la next time be na mba fo.
Okay, mbad. If you want to hide behind amon fo na tablo kan mba find out la. We will get there.
No problem.
Ya famia. But I'm privy to the fact ko wo complain olu wol ka futalu male. Wo ko mbadu nana wo complain olu mbadu am come wo complain olu
ngamin long wali tabla let me tell you ngamin long wala mu demband ele ko EFSTH wala nan ko mama moy ado mamero soto fanan ngam moy demband o metal fango soltal o fango one person taraje men kan personal taraje aya je ko jo man taraje bal o fanan preso plumbing challenge le beje kabiya plumber preso job ka preso yimbo ko fota dadolto wakata within 2-3 days lem mo ina radite ko yara fang presso la buka sele pour ka dado pour ka jo fana futane dado to da man gal plan hombe man joso hanide da do lebi men ka be jo because of jo la presso ye be nyami to be santole so jo buka sele na sando pour ka pa na do mo office na janna sala pa presso sa mba pusla so wala kada bo ngo kala mutal adun diamuta ko la nga ko fana na ra ko to nyalam ako solfta but comme ka fo albi EFSTH wo maw kala muta mboko na maw kala
a thing as important as lack of enough water supply at one if not the biggest one of the biggest hospitals in the Gambia. Let me say
wala na maw kala muta
mbadungana alcom mbadungana yes alcom ima kala muta okay I respect the fact ko come eko ima kala muta
okay mo yo dem mata mo kala muta
okay fine Gio me along ko you know is basic. Very.
That would be an outcry.
Okay, let me.
We
will get there. Gio
no problem.
We will take a look at problems one by one.
No problem.
Gio, me alonka kumata bake surtout mo me alonka mankende. Gio is a necessity. Gio muku kuma baldi o kam mankinde tano. Ite ko mo kalamuta as director of health promotion. Njikita ko information ajama bal nyanda futelete mati so ni mo kala mutan jaay ya mi rete bela doko ke nyanda kala nyamba
thank you na communication ni ngafwe PRO ya soto they have a communication division ni issue soto they communicate to us through email or through telephone call ni be carry in case you are asked you should have seen the card be carry le panga but ni ko ma information in soto do segment ko manata na dogo ke kande. It's a semi-autonomous body with their own structures on communication.
Yeah, it's a reality out
possible.
There. Yeah, it's a. I cannot force you.
Exactly.
I respect that. No respect.
You don't know everything.
Okay.
You only know something.
Okay, so I'm telling you from strong grounds.
Okay.
From all confidence.
Okay.
Kaitandila konjai. RVTH. Giomu problem multijay. This is the reality. What do you think the government should do about this?
You see, Gio, you remember at some point we have erratic water supply. Okay, you have erratic electricity supply. Okay, it doesn't mean continuously for 1 day or 2 days, 3 days, a hospital without water No, that one I don't think that is a true story. I will not agree with that.
What I mean is enough water supply.
No, thank
I
you.
want to
Now
make
you
it
are
clear to
coming.
you.
There's
You
no
understand?
water.
But there should no. That is what I'm saying.
But if you say
Yeah.
enough or adequate water supply,
Inadequate water supply.
that's fine.
Ya famia. What did all from pompo dolo je jiol bukanana je.
That's the water pressure. You know
So
that-
what is the government doing about that?
But you know that.
What are you people doing about that?
Now it's supply.
But you don't have
No,
any. You want to tell me you don't have any option? I'll tell man kudo so tonal semen keno kaje ko sasa tolu kaje ko molu mel na
But
kasila sasa tolu.
you know what the tankol je EFST. But the pediatric.
So what be the purka dulal ni yandi.
It's the water. It's the water.
But it's not coming.
No, the water goes up.
Abukana.
Okay.
Abukana.
Are you sure?
I am 100% sure of what I am telling
I don't
you.
agree with what you
Abukana. You don't agree
It's a
with
water- a
what? But you
hospital-
go nyema kalamuta say go you don't agree.
No, because the thing is, you come in for the role on town.
You go nyema kalamuta. Now you are saying you don't agree.
Sultan.
It's like you are trying to defend yourself here,
No,
Njai.
no defending. What I'm saying is, a hospital without, I cannot imagine that. Hospital without water for 3 days or so. No, then there'll be public outcry.
How do you know? How do you know it's for 3 days?
No,
It looks like Njai, you know something about this.
Example for it. Water supply will be like maybe certain will be like 2 hours, 3 hours.
But is that right? Jio nyanda mankule dula beto
Yeah.
for hospital.
No, yala minam. Ministry will not sit down waterman telepano kono manfenko. It's not possible. But all because I would have got that information for Jemanta in London.
Okay, sa
The
ngana
media will
okay.
even pick it up and let
Okay,
me
sa
know.
ngana borol.
Yeah.
Borol mu problem ol de leptanol.
Nyadi.
Enough borol buka sotoje.
Nyadi.
Ni na leptano de prescription okay. Ibita boro min sanna banda wolbe siala be men dile laje. Ya faham yale. This has been a problem and it has been there for a very long time. Puro ka foko problemu tije meya membe dendi wala kata leptano de mom borol so de nyante sot la nyame mamira mo bo la moyla. So ngajeji be bang mune nyi sabu adum fana ministry be muneke kanyin ko.
Lafta kuma killing for the boro killing. Mo kana daro boro kan wat do wat. Boro man toro wat. Ba boro fa na to nyala mu amanka akamankile. Akamankile. Ikamun fotan situation ni kasala. Ba lafta ben fana fole. Mbe muna kono mantra covid period la kono. 2019.
Just don't hide behind COVID.
No, wait.
This has been there for so long. Janin COVID bina. Ni metale.
I can't follow 5 years, 6 years, 10 years ago.
10 years ago ni metale.
Aha.
Yeta leptano de borol di leke hillale fon ni kada ni la ko do mbela bana pharmacy
It was improved around 2018, 2019 when we have the supplies. But right now, it was difficult. Others mean we couldn't get them. There's nowhere you can pass the ship. The others you cannot try.
Yeah, you are trying to to hide behind
Why should I
COVID.
hide? Why should I hide?
Yeah, of course, ibe ma
Why
kan
should I hide?
COVID-19 le koma.
No.
Borol.
Sultan, you want information?
Boro.
Where you want to put that information on this?
Ambe kacha
Now
kan.
listen to me now. Let me
Ite
give you-
ite alon nen kamen fojante. Mbela ko ka jana.
Ila mo do.
Okay, na.
Yalo.
Na. Na mbela mo ka. Iko problem ti jete la bo.
Yalo
Sange
procurement.
jibe.
Procurement na la procedure long.
Mhm.
They borrow procure. Like for example, India, maybe Egypt or wherever it comes from, huh? It has to take a process. It may take a longer process than a final. Shipment kala. Now, this shipment are a process that ship now. When you enter that ports are not open, certain countries the ship cannot pass there. You know what was going on.
So how do we ship man futana?
Up till now, so go to the Kotu now and see. We got a lot of containers, Minata, recently.
So what is Njai? This is a problem. Me alango it has been there for a very long time.
Let me tell you now.
Gambia ndol dal
Let me
silan
tell
dal
you
tele
now.
ko moy mel
No,
munu tan
Boro.
na jamana lama ko no wol be yalla ko leptano re tata wodo
Mafa manke promoting. But as of now, logistic management system is well improved, one of the best in the sub-region. And we can tell you, they can tell you, that EFST any board card bidia or a board card in Yantamankale, they will tell you in the system. It's well improved. And then your suppliers can enter Kakanyami.
ya hani kunu
But we have
amoja boda leptano
we have a national pharmacy.
ay men sang pharmacy ngoto wala siada ay men sang pharmacy ngoto
Atafolo ka man fenchara mo.
mbadu ngana ay men sa prasta mo nal dal tamen
Ngo.
o fa for real lom for fake lom malo
aga mo to ka ko mine ka funade
wala bi jede paracetamol yo dia
paracetamol mo se fix to a government system
mbe futala de we will get there
yalla muna wo mo le diam ko fan alfa yalla waru da fan ke la mo le diam ko
okay mbe futala
de no kata right now hospitals are supplied from the central medical stores. At the central medical stores, hospitals have their own stores which they supply them directly, and they are monitored through the system. Nimula stock nyanta banna, it will alert that stock X is going down, you need to replenish. Then you go to the regional stores. The regional stores also communicate with the central medical store. We have about all the regional health directors, we have the stores there. You have the Canifin store, the Kama store, you have Mansa Congo store, you have Bansang store, you have Basse store, you also have Farafenye, and as well as SL. These are the stores we have. And we'll better communicate as to what levels do they have. Poka for sign borrow mass of militant sign within this period. No, you cannot. More about follow drone. Yeah, I'm coming out for to. Come more satisfy Mandia. When in other countries,
you'll made a cake.
$100, $100, $150 you paid as a car, registration, you get all the drugs you want. Now let me be very honest to each other. Other countries, it had a prescription alone you pay separately. Only in drugs on the clinic. What prescription and combination of prescription and drugs at most $25 to $100.
But sila ni ka paracetamol da mala dia.
Paracetamol jumalo fote. Ito wajimto.
Aldal da wala. Paracetamol waka sotol.
Jumalo fote.
Paracetamol nda fa nga je nyala temne njay. Nga je nyala temne. There are times mbadu nyimange kuma kandi. Nyimange kuma kenzendi de njay mbadu ngana.
Sometimes molka move for.
Mbadu ngana. Just allow me to come. Ha iben so la ngana. Jam fo sen so de because this is very important. Gambianol meta kumbola. Gambianol meta kango faila. Gambianol be damen sai jikilate ta la health system wala fanala. Because mena ha.
Afoy kana jikilate.
Al tolle nyanda oitandla. Andal nyanda min kelal man tara keka. Al nyanda min kelal. So why molka da leptano? Why molka da leptano? Isula da borol menna borol ye boro safa nyin kuranne bera malaria. Nyin bera. Inyanda kwati motala. Inyanda paracetamol tala. Inyanda bordo tala. Ni parete paracetamol dila to nyimbe eta be sam bidiko. Eta be sam pharmacy. No, I'm giving you an example. Example yeta be sam hospital. Yeta be sam pharmacy ngol. Wol be kerine.
Okay.
So man sakunda be mun kulle ke kam pour ka je ko nyulia dang.
Laftamin. We want the communities themselves to participate in health. They participate. Doesn't mean we should be looking for fault for the health sector. Akolahal, Jarikenda Bunda Anamanang more satisfied anywhere in the world. Akolahal Puka more satisfied anywhere in the world. Akolahal, not possible. But the Manon Beje, Fonga Mutanyofe, and no support.
Yeah, the man didn't get.
No, but
Kodijamala Kanad.
No,
the man didn't get. Kodijamala Kanad.
Let me tell you, a simple delivery bed. It will cost almost $3,000. Simple delivery bed. Not for sophisticated one, maybe about $4,500. Health is very expensive.
But we all know international body. Jama balaka donation. UNICEF. World Health Organization.
Well, they don't do
CDC.
much, but they procure for us.
Ha, ya faham yan. Wujama bal demaro ka futa Gambia mala wo senyata la be larinje. Ya faham yan. Anu komi ya fo nyame. Nim banko mu banku dinnet. So nindo la healthcare system abe as fragile as whatever you might call it. Ide amira ko wobe nyadile wo ko be larin fal dimala ko.
You go fragile, but that could be a perception from your side.
No, that is the reality.
For me,
na healthcare system wol jigilate la ndu wala muto nyati. Nde I'll be honest with you. Nde famata tala def dano do meta. Because no amanga ko mimbe kende yaren. Of course alhamdulillah mo se duwa jata kende yaren. Ya faham ya. Malaria me muda mam me bag. Nta pharmacy ngol. Because nga feel ko coming se ko do pharmacy ngol nyanda follow la because nte fa jikilate ta. Of course yes nte fa jikilate ta.
You have a preconceived mind.
No, I'm not having a preconceived mind. The reality mem muto nyati. Wole be tabulo kanja. Ya faham ya. Wole bod mem bi njay. Silang. Sinya jamalan tolo nganyinje aketa dola yesa sa isulata treatment o minna isulata service minna imo wosotono continue la kataji
itala je time na tumanda askena amansoto bani mbura jogone basula malla fe min no ya fugon
mo jelle kataje mando a sekeno amanzoro mo jamalle tata je kilim fula saba nani lulu hani bi wo system kilin wala njaay lafta dinalal ko min manke kesi
dal sina kilin do masoro ka mansoro frek wala mun concept
andu wole bi jede
that's what people think
andu wole bi jede
no jang wala ngenda bola
andu wole bi je njaay alla leptanol to kanyum min foyta be larin jeten silong sign ha membe leptanol don ka fo nyame you and I know it's up to you to accept or not
no you see the
but ngami lo wole nyindi ko
you want to like see us in a negative way won't we accept now because at least we are doing something
no if you are doing
if I tell you are going to service all access
you are always quick to talk about Allah achievement.
No,
but you always want to hide behind things to ensure problem will kana kaja. Okay, sign. Nga jumping ada blado. Birkama health center. Kurang shortage ni kurang kita problem utije. Shortage of electricity. Aye ali yang kalam.
There is a problem with the electricity.
Kurang ka monkey.
Okay. Abuko so mo keje fanko.
No aka monkey la aka sotole bara aka monkey la nyanta sotla nyame leptano to. Aka ni ko ka monkey obviously.
I know that there are solar panels in that place.
Okay.
Yes.
If there are solar panels will be jele.
Yes.
Generator fanam bi.
Yes.
Okay, fine. But I want to let you know ko kurang nyanta sotla je nyama abuka soto no jewo nyama.
Is it low voltage or what?
Well, manko
okay,
manko.
Are you? No, go back again.
I will not go back.
No, go back to the
camera.
No.
Honey, Manda go back. Manda go back. Ngamin for is clear.
Sultan.
Kurango ka monkey. Mbadunga nana. Kurango mbadunga nana.
Okay.
On several occasions, indefango personally, ngamo samba biriga health center. Mbadunga nana. I'm not denying that. Standby generator. That is what I'm trying to tell you here. It took some time. When that happened, when that happened, generator nada. Some areas, some areas inadequate electricity supply. So are you aware of that?
Some areas are already connected to solar.
Okay. Some areas?
Yeah, some areas are connected to solar. Those ones are essential areas like the maternity.
Okay.
Well, those are essential areas. Light should be there throughout. Maybe perhaps Kabe General Mala, they have to change over switch. They have to go to, because like for example, Nukurang be on. We all know. Nukurang Mala, Nukurang Fata. Automatically, General Mala for change over switch. And if the other buildings are all the same, like you have to go around and change. Perhaps the navigate around maybe it happens. In a hospital like Farafenya, I will give an example. I started there in the around 2000, 2001, when they were putting up that hospital. Near General Mala, some areas will have, and then order, then you General Malta, then you have to go around to each of the blocks to change over switch for the light to come. Maybe we'll try period the generator man is also going round to change over switch.
Okay, sir, are you trying to tell me that there is enough adequate?
The one I know, they are connected to the grid.
Okay.
In our grid, and also they have a standby generator, and some of the areas are also connected to solar. That one I know that.
Okay, let me give you an example.
Let me know the exact problem.
That is what I will explain here. You want me to go back?
No, what I'm
saying is very clear.
No, what I'm saying is
No, that's fine. No
problem.
VIP VAB. So hospital kono ni dula be mon sola sodo wala generator man dula be supply hospital kono ya faham ya adun as far as I am concerned hospital do dawda bi ja kumata hana man electricity soto no dula beto bor dulal mel ya lon ka kumata electricity bi je bawo nyanta man lal ya faham ya so mbe men na sa
I think we are now trying to go around something the whole place is connected to electricity and the whole place is also wired with the generator. But if there are change over switch, you need to change for every block. Obviously, there'll be light.
So are you trying to tell me that there's enough adequate electricity supply?
As far as I know, among complaints of coming generator, more information. As far as I know. more information so ko generator be jam on fuel soto wala maybe at nyata mo but I know there's a generator, standby generator, and there's also they are connected to the national grid, and also there
okay, I put it to you.
Yeah.
Well, you gave it a different meaning. I don't know for generator finger. You're trying to hide behind that one also.
That's the reality.
Okay. I don't know. You keep hiding behind. I don't know. That's your strategy. Okay. Anyway, Sai ngata up countries ma fa jibero ke jela.
No problem.
Allah health system. Nana da jata kende ala fannala. Santola satelu ikabata baki. Ali en kalam da fama al kalam. Ikabata baki.
Ya dia fanya bang.
Okay. Mbe example di le. Satel bi je meli alon ko pour que la mol fa futande le tanol da ambulance tije fentije. Ni la mole emergency so. And they are Gambians like us. Ni la mole emergency so. Pour que la mol bondi ka samba nearest hospital do. Aka kebulu problemo me alon ka warta. Ali en kalam da falma kalam.
Ha, sana eka kumas. Nakata kumas wato ngum fo nkoko. We are having primary health care, secondary care, and tertiary care. In the primary health care, we have community clinics, we have health posts, and we have village health services. In a health post, you have a cluster. I give an example. Like, let's go to Nyamina. Go to Mahmoud Fana, for example. They don't have a health post, but there is a health post at Battinjol. That if they have any case, they refer to Battinjol. And there's already a resident CHN there, who's a well-trained somebody, who's in that particular community. For that particular cluster, Momo Sahara Kesambo clinical.
That is the question.
No, wait. We have one community ambulance. They can call the health facility and then they will pick based on the condition, in a condition of Abinyami. But if you can be able to walk in a
whole of the community, one ambulance.
But it's family cluster. There is no community, there is no country in this world that can give every community an ambulance. There is no community. I can challenge that. But you give it to a cluster. A cluster will benefit. Cluster can be 10, 5 or 7 or 10 or 11 communities. We call it could be a village health services, or you have it, or maybe you also have a community clinic. I'm talking about giving a typical example. So if Battinjol cannot manage that particular case now, the ambulance is already stationed there. They will make their referral and they refer to Kudang Health Center, Minor Health Center. If they cannot manage, they do all what they can do. The ambulance is also there. They also transport to Bansang for proper money. If Bansang cannot manage, they also have an ambulance. They are transferred to EFS.
But are you sure you can transfer nicely and easily? You don't need to hustle. You don't need to.
Let me tell
are you sure?
Our nurses, they adhere to the referral protocols. And they know who should be referred.
I'm
giving
talking about the referral protocols.
Yes.
Adhering to the referral protocols.
Yes.
And having the referral done are two different things.
Okay.
No so sinano, yes, these are the protocols. Anyanta kela nyame kaito le da hiara anyanta talale. But are you sure ko moto ambulance o me alonko anyanta wol sambala. Are you sure what katara available in all the time? Purga make sure the patient do let anyanta tala dam.
The only way, let me give you one typical example. Like Nanaba. They have a facility that the nurses are there. If they are supposed to go out for trek away from Nanaba, maybe we want to go to Njobe, whatever, they want to go to one community around, then a patient can come in their absence while the vehicle is on track, but they will have to call the ambulance, the ambulance will come. Normally, I've got jump for jail. We operate in such a way that the ambulance will jump for staff will be down to my phone. Like, we also have outreach. And we have base clinics. Women will come with their children, the pregnant women will come and get all the service that is required. It's a base clinic. But at some point, they can travel out, we call it the outreach clinic. The outreach, Diamond, for example, I don't know which areas do you know in this country, I can explain it. Tell me which area you know, which of the districts.
Okay,
now,
Kia West. Yes, let's take a look at Kia West.
Right, so we go to Manduar.
Okay.
If, for example, Manduar, that's the base. for that particular community. Then because there is a community Cuban clinic there, as far as I know. The Cubans, there was a Cuban clinic there. Cubans used to be there. So that has also been transformed. The community, the CHN is now occupying that particular building, as far as I know. So anytime I'm making referral, a person coming from Jolie, a person coming from Gise or Bankuling in that area, they will just refer them to Mandwara. Mandwara, they cannot manage, they refer to Karantama.
But remember, referral is not the problem, but the process of it happening. And we are going round the cycle here. Are you Soko?
Are you listening to me?
I want to ask.
Let me just I'm giving you one example.
But you've been going round the cycle.
No, I'm not going round.
I asked a simple question.
Yes.
Are you Soko? Can you referral for Nyame?
It's going on fine.
It's going on fine.
As far as I know,
there is no problem.
If there are complaints, the complaints will go to the regional health directorate. The directorate will pick it up, and then they'll bring it to our SMT meetings or maybe our regular meeting, and then they will know the challenge. But I know the one key thing that may come up is the issue of availability of ambulance and fuel, and that we don't have that complaint yet. As far as I know, more complaints. It's possible.
It's
possible. Yes, possible.
So you people are not also. If you don't have that complaint, to you, to you, everything is going fine.
As far as I know, not every system is perfect.
No, but
there could be at some point. No,
we are getting to somewhere.
No, it is not.
No,
because the thing is,
that question.
no.
Because as far as you know, every system is not perfect. I will allow you to go ahead.
Exactly.
Okay,
so now,
go ahead. Explain.
If there could be an ambulance, one perhaps the ambulance has come from another trip, and maybe for them about the sealer, the ambulance driver will alert, and now they'll communicate to the regional store. We have a regional fuel dump. Every regional health there is a fuel dump there. And these vehicles are managed in such a way that if you come from your side to referral, they give you referral fuel back. That's different from your routine fuel. That's a referral fuel. That's they call it a refund. And there's also routine service fuel. The routine could be your RCH service communique and also going for supplies in terms of going for medicine. Because, like, for example, the facilities I mentioned to you in Kia Mandwar, for example, and Karantaba, Karantaba will supply Kia Mandwar, for example, if it's as a clinic, a community clinic. Those ones now, they will also need some ambulance movement. So those ones, they call them, these are the regular fuel supply. So, but if it is referral, automatically, when you go for referral for Bansakonko, they'll give them a refund, they will give you a refund back. Like, for example, a typical one is, for example, like Sibito. Sibito, the ambulance is there already. And if there is any problem in that particular cluster, in that area, there are about 7 villages in Gambia that are already around Sibito, about 7 of them along the border. So if they have any case to refer in Care Central, automatically they will know, they will just refer to Queenala. Queenala be the minor health center. And then the ambulance is available in Sibito, and they refer to Queenala. And Queenala, if they cannot manage, then Queenala will refer to Mansakongo, where you have all the facilities that are available. That's our referral system.
Are you aware of the situation in Sankandi?
Sankandi?
Yeah.
I know Sankandi, there's a tricycle there. I know there is a tricycle.
Okay,
and
you know about that?
Yeah, I know the tricycle.
Okay, Juma Lodi.
It's normally, is it this RBF project? When communities have this subsidy, they decide to buy anything they feel is for the interest of the community. Some of them will go in for a tricycle. So a kawala sang dol ka fuko mbe nyotura masmo sanna dol ka fuko mbe dol started with subsidy like RBF program in Benjamin. As the community do more in terms of health improvement, ya jarakenda ya sawatendi ya sato senandi ya
so ya ndela fa men ha no sa ndebe men
ha
o tricycle o membije iko ya kala mutal isonda ko sankandi kian sankandi e ga yalon ka bije o motorcycle o membije lafta melon ito le asangi fango bang fodum man sakundala ya di
sat yalon kam for the sat man sakundala project ko ka World Bank project. It was under NANA, National Nutrition Agency, being implemented by NANA and the Minister of Health. They call it the Maternal Child Nutrition and Health Resource Project. The Health Results Project, you must have to provide results. For evidence, for Ifang Bondi, as a village. So, Dolka Saro look at 100,000 near subsidy solo. You got like Satola Senata, the Musoka Nose Juna, Muscoma Frankara Nose Juna, indicator Lebijame and Kofo also. o sumandir la on la beje ko ta ka jibe ko foyi mu ngenta mi ko ni o to ni ko do kam do sa ko ndolde al nga jibe mu ben na fala e brake
sa kam ko sati fangol let's say sati fangol o sangol
bumbe be jama jam sa ko sati fangol ke sa la ko do ngindo
okay sa Modou ngana nanje tricycle ite yalo naka kenyame
na
tricycle ye patient o landi o kan tido be kandiring surtout musu konoma ye musu konoma landi o kan ya bolni nan fanya ndabola damen ya samba leptano ning atara la situation o critical telephone there has to be another struggle pour ka bonde o ka to samba o e ko o kalamuta comme wo situation o bola nyama ko fatije fentije yet alman ku ke o to ko be nyani
let me tell you that o tricycle ni sa to dol be yale ka mu nek ye ku yon kala
no men no nganyina sate la karo mbe altol yala ya kala
manga nakale
aldol manyano ke
no sate la
aldol manyano ke
we wanted the participation of nibe jade kala la mo la foi fo participate
no mbado
no so
this is different
maybe you don't understand the
no this is different okay mbado sai mbado
no I saw the video
I want to play it for you
no I know
bad attendance they have problem Abidjan Ma'am? Honey.
Last time, Uluta je bar wolu nyata manji kay to feneji itu yaji docteur o fawme be wolu fawo yala fano ta fitala de ko mbida fongo ina ko yani tawta le man fongo ki ja fawne fano ta jambe fitala ko ni ko iba fula
yo sanita ka mutol tamamere batingo to ika protective equipment ika kom bulo ko dunne wala fendumi alon ko ibe fango
ko bala
yala kani mole kata yan tintala kata timutala kata je
ko di waka offensive ka kulo fol dunne wala
ko ni ba mo pare do wal kata ngi tar nyame ke pare wala nyama do
kat wati fini
yung do ke do doctor wala do ati do ni kala police fanali wala stand ba yalon imagine mobile police ni selta nyokanje ko nga pat kar bare wala fo at na ngay sa pemba wala mo pen sa fertaba
ka sankan
ko ñu ambulance tay ko no
among any
man so
the sound
bar beri ne fudara station ro kala wala ko yalla ñu mbula ni muy ambulance beri ko canada wa mo na da ngay
kor fengani ambulance silence
tala ana Ani tingla no famo nyi.
Mune nyi na. Mune nyi manda da.
Kodo man soto ko. Kodo man soto janno mala corne blade jang woto tinyata.
Iya,
Na ko man. Ngo.
okay ngoy nyinjal yen video jala men bije ya jala ako muso wuluta je anno alien kalamdal and that is the environment we all know tiloka ke nyama nin kudo ni fanko musu konoma ibe larin tricycle ka wo nyama tilola exposure ite nyanta wulula that situation is detrimental to that individual me alon ka bo condition or aliyo kalamuta aliyalon ka be caring al nyaba la yet al manku keje mino sab
kana sultan left them fully left out on the sango health. If you look at the health promotion language, it's the process of enabling people to gain increased control over the determinants of health with their full participation. They must have to participate. If they don't spend anything on health, they will not regard it as
but they need to participate in this way.
They have they got it as a result of their participation in our intervention.
But that what I'm trying to talk about is
no, I'm just telling you this.
I know everything
about this.
But what I'm trying to
the
ask
subsidy
is
they have, if they decide to have this an open one, the communities could go further to say let's provide a cover. They still have money for that. Every community in this country, if they were implementing the RBF project, they had money, a lot of money. agreement on what kacha kono kacha commence wato ko nale kanga nyaron so ngin danto al baji ba lafta project jumal la kala dol ka ñoo tura masono sang e ka ñoo chaajala dol ko ñin tricycle ñin cycle ka mun kala ni e sambay bo 150 la jora wala $100 saro do bije to la badi ma fon la dol nga dol je mengo do ko 200 la chaaj ni e samba person ya fon 200 sate mul fon d'accord tawala o to e ka ko do min jo ka fu ñoo misal fe e ka wala explique essentiel sanje because they have to participate fane participate ko kono e fana yaji ko tel fon tamu jare kana mo tel fon tati e kana ju commence fon tamu
but sila memena is it right ndeke ñinin kamen na sai it's not about the question is not about
no
ila
is it right
I'm coming just allow me to ask my questions.
Health is a fundamental human right.
Thank you.
Huh?
Thank you.
Yeah, let me tell you this.
Sila mbadu nana.
Good.
You understand? It is my right. It is my right to access quality health.
But with their full participation.
You understand? Okay, with their full participation. Thank you. That is what we are seeing here
exactly.
now.
That's it.
Okay, is this enough?
That's it.
Are you content with this? Are you satisfied with this? Now let's take it from that end.
Now.
Nga jibe jale. E content
But what me content fana, they've gone extra mile. Purka tricycle through their own sweat. Which for me, I didn't true for staff or coach to get this. Community development, National Nutrition Agency, and the Minister of Health.
But sila ngimang kontan ni hani biya be ke ya kala mu dal man dara ku ke kan mune o sabu lafta wala lon musukono mal katara tricycle kan ika wuluje that is detrimental to their health ya kala mu iteme mu director mbadu ngana imu palasi tiyotije minister ya kala mu permanent secretary ya kala mu njikita ko nyaton ko jama bije mel yalon ko be na health sector do ya kala mu tala ko min nimbe keri yet alman fenkeje laftalon na wollo lafo wala lon na mine o sabu
jalon
iman kontan ya kalam da muna sabu
no yala minem imang ni la moyna iba nan ka dam do foyta in ko jare kende man sekunda dam ma buka akeno 100% wala tane project kana minna nim project be implement la ay ka sarato la lande to nyalam kun nal be project karikala ni ne bila rakunna tola ni nan kanga nyarawde bare kanga nyarawde to le baji wa lafta minne mi mala so la koti sa do sena tombon iko to lafta nyoto ramazon la dol sa ko to lafta karal la machine la dol lafta to lafta bitiko la dol sa ko lafta tricycle wala min cycle la
bar sila janni
la moy
okay
la moy ni wo botala ntanga sato jamaaje mi an ko tricycle so ni fon ndefon qualification fon kono ko ya décorer le kendeke yes ko yama be kala
ila responsibility la what
is community support. They are also supporting the health sector.
But it is not supposed to be in this way. At least there should be an ambulance. Let me come there. Not every community can get an ambulance.
Like Sankandi.
Why?
There is no health post in
Not
Sankandi.
Every community can get an ambulance.
It's a key village.
Okay.
It's a key village where you have a resident community health nurse. Village Health Service CHN is based in Sankandi. I can tell you all where they are located.
Okay.
Okay. Atala's role is to supervise, to do health education, to do census, and also to help mothers, to get them to be able to register antenatal care on time. And also, the village health worker can supervise, and then you look at them who can supervise. They call them this parent, they call it community birth companions. They want them to support the communities. But minimum promoting, if Sankandi, Jifarong have a clinic now, which I know Jifarong has a clinic there, and there's a resident CHN who is also there with another village health service CHN. So they refer from Sankandi to Jifarong if they think what they should have to be. And also there is a clinic in Jataba. You understand? What clinic on Matano Jataba is Sitano Sankandi. Then Sankandi will manager there is a clinic, there should be an ambulance in Jifarong. Jifarong have an ambulance. If Sato be book ambulance would not bela. You understand? Malafo understand. But it can't do that mango, it will be strategically located to Sato base in Munafangala.
But in Yulur Mantre Munafangkan.
No, but if it's still they have access.
Imantare Munafangkan.
Is it my understand? They have done very well. They've gone further to get their own tricycle.
But I'll drag you back again.
No problem.
Iko imang happy niya.
No,
imang kontan niya.
Design yami.
Imang kontan niya.
Namini je. Ayun sa temol fongole okay faye. Through their own initiative, that well the man on there. Ye kuyawan ke. Ye ridol be. Fond like a ridol be. I've seen it. ngaji sade jamalto trasa ko natame def ay fonka admire
but is this really safe
No,
pour musu konoma like is this really safe hani adare rido ke je trasa ko
it's a means of
duma silol nin dulaldo
no bari sankante be daminto ala location abi hala sila baraka manokan killing this other way from manolom kan almost some silo parata almost kiankol sa ngale sai ba celebrate ko silo para very soon almost wana ko la kanje so that is easy to transport them to Jifaro very easy sankante Jifaro mo jamfa this is the next point you collect from the satellite villages ya samba ye collect ye samba to the next point mo fanama manage no you go to the next level wala na health system on you ajarante go dimang imang perform
even though amantara taka
ngaw ka manda taka yo mo mo
oh is
na manda taka when it's then the better manager
it's clear
the last system of yala to wallahi
it's clear
but I want you to travel malla ka mangol to fujande but I want you to travel around us ye murna yala do bital ta travel around us ye murna yena fo mo ngwa to yato nya alfan ba kata kan yala is important almandara kataka hande ma okay
nde mon tamade
okay wala nango
bari ngaddo man neomi suute dulal
wala nango
Gambia health system you people have failed us woefully so sa nga kajayal man
kala bo ngal fil
nga kajayal man
mi dabula bol feje fele mol fil
okay sa nga kajayal man
okay
sa mbida dulado
okay no problem
of recent nga jele ko atata fo mo keme saba mo taworo la ninkini me alon ko public health official lom Ministry of Health aliyo le suspend munekata 371 public health officers
mala fika diam ñu ko kan because be diamul ke kan sulta ka diam dafa public health official
ha olon ne
ayo lonje
olon
anu fana be association ñu ko
okay
so bare commune don ñoo moy bal yalla mu ninkata adon kamol la selta ñokan safono kam faliketa o kada bari kacha be ke kanu bak ya kacha kuma to nunja executive fo ini mesi e meta kacha la bak tanin na meta tanin na commune don mewla keta dol pasita juna ba kacha be ke kanu da mol tema adon kabin mewo keta yin karo keta entara fanga bam fang suspension on akarento fanga be surprise because ntolen mediator de ka call mediate ka dinol diamu dinole manan akare kam panan manga keba balte bara le panan ntamede mun bloko na jama be manta system ko ko dan nta ntol fana be fana nyablo ntol fana kan tol ni na tembol diamote ya congress o commande e lungo muta e ko mobe mur do ko la ada jumalu modo le do ko commence e congress ke Thursday agree da ko e mur do ko la on the 4th le congress ke kon fote mo doka but that Friday dol tara dokola those in the combo Saturday fan dol tara clinic for the working mothers dol mbe fototo bansang basse for a travel on Sunday for a Muru station dol reporter Monday dol within combo here everybody was happy court in that day everybody was happy mobile reporter so Monday will arrive a communication also from Public Service Commission so they've been suspended 371 of them Chocho Wulta dia mosiata mistego dol na dake membe ko dol be registrato dol lista mi anko tumando wol bantrano around dol be story leaf la wol be go listo nyin kono la so woy dia mosiande na rafu ko sa al nga jibe ton be nyin ko kachala nyamen pour be nyin ko lande nga be bula mirankile o kachala be keren sa nyin tambe ba ngalon ko as far as I know koronto keta comme ni mo be korontere ngala kanin to ke
jumala korondata
comme don association ni sa fo de
idole korondata
comme sa be koronto mi minti don ye nginen karo ga fennala afana processor be ke kam pour ko fana
wala mundi
wala mo la allowance wolti
so allowance yes
so
nga kaja kono fanundi
allowance community la nga jele ko allowance finta non Dr. Sol PhD holders no sol be soto non so bo defal fana ngini karo ga kola boy to fana ngini kar do to fana pharmacie ko le bula be kono ani laboratory be bula kono pour be sa sopno pour be se mona fona so kono nyomo manke no alhamdulillah sa nga nyomo katale And then tumando kuma kan do fanam fota association members of fanambulu during the press briefing or the media engagement. And definitely kunde wonte moment mi an kon tele mo definitely mo mi an kon fananga ila page to nga very strong message dila ka tanni ko suspension order as civil servant suspend, you have to observe the suspension order no matter what.
But for nyanda suspend la ba.
No, it depends on Public Service Commission.
No mbede
No, but
nyanda.
no, ni no. Suspend and yeah. Determine no ko.
No.
I'm just coming. I want, okay. There are certain things I can answer. Certain things they are beyond my purview. So we also told them again to let them avoid talking to the media because
why shouldn't they talk to the media?
No, because some of them
when you people institution
some of them
when you people have failed
the approach to the media you can talk to like today I'm here.
Mm-hmm.
If I'm here, you know, it doesn't tell well. So sometimes the approach matters. They can talk to the media and tell them what they are doing and so on. Let them showcase what they are doing.
Okay.
No bel expect no, but saying and come for bela. So suspension on right now.
Okay, is the ministry is ila approaching? Is it right? Because is it right pour que suspend?
No, suspension until I made suspension and the suspension.
But kachaketale.
No man karo.
Kachaketale. And the ministry nyanda menkela. Ima waleke. Kachaketale. Strike mbadunga na nansa. Mfanangana. Yala April May. Strike ketanu. Dia mol keda hiarandea. Imurunda dukwala. Iko allowance ole lafa. Abol kono on called allowance. Isonda. Mbadungana. So I bol kono nka kilinde dila drong iko pour wolé jo ministry ta fa say ni d'accord mais joro be kala joro man nake so joro manke andu lahido le dite la comme nyimbe jola la manke imo lahido ti man ye pare ye suspend ite amira wodum ku kendo ron fa ku kendonde
actually suspension o yage dawda abu kula mi ango kula nakata but nakata fanan with this magnitude number of people 371 tonya Kolara mangana kala nak 371 shada back. But fanang
it's not about the number, it's about menketa.
But
because ministry ye symbol jay public health official kang.
No, semente.
Isonta jela foy manson.
Semente yalo ninga nyom.
Isonta jela foy manson.
No, sembonten. Yalo
okay, sa mbadunga nana.
Yalo ni la fan ne nyom.
Okay, nkan minala le, mbe solale.
Ni la fan ne nyom.
Lafta mem fola foy fanan so nga jela fo. Public health official al ni kacha sodo. Comme nyimbe jolale. O jor wado sida manjo itol fana nyanda lud la kala mindi yoke ye pare ye suspend
bara fotale minat na manjo de killing
wallahi do
no lahido bari sayete ko do bi no tan yeta do e ko do bi boto ko yas gaadi mon
okay a fotale mu ne foto
killing la mo government money momo ko kam beta ba bi la ngas wona ngadi la kay fel ata keno
bari yala ata keno la ye lahidi
foita no but ijikita ka be jela but you follow the due process. For due process normal. Someone below the mother account. So the due process will start from one approval in the cabinet. Cabinet paper. List of people baker. It only did a very good job.
Faldol malon ko baby jele janal be lahidi.
No. Ila mo follow.
Jinin karo.
No, ila mo drink.
Fal malon ko due process bi janal be lahidi. Lahido nyim bole jibe kanja. Ali yakka so dal ko embe nyinkela. Menyin ngaro. Okay, ajana. Saya ngajai na. Aja bef.
Saya kana kudude.
Ande kundula ajana.
Okay. Kabi wokeda cabinet approval ngenda kala killing. I budget ata Ministry of Finance. Financial review. Ina preparation prepare National Assembly for endorsement. So that it becomes a consistent a continuous one. Or processing will be on. Or mambang suspension on that. But let me also tell you that the association executive, they have been communicating with the ministry. Coming up for Yamindon, miscommunication at some point. But to them, they have followed the process and ministry also will follow because PSA letters of a Galina to tell them what the ministry is doing, explaining everything. And that letter was given to them for their consumption. But thinking they will go back to work after having that letter, at the start of the ministry, Kabio Mankajorong, a final call, final warning was sent. So it will comply by going for a congress. As a result of the final one, they went for a congress, which is normal. Congress for it to get the consent of the members. They went for congress. Kabio Congress if happened then in Arajako, we have to go back to work. They've all agreed to go to work. So while some people they started work, then suspension letter in that.
Okay.
So
which means the problem of the ministry abala. Ngaje jibe sa. No sa ngaje jibe. Imam pare ka sonjere bare mbeje jibe. Doctor, they strike kejang. They were not suspended. They demand fulfilled. Killing. No soul will they strike. They were not suspended. They demand demand detail. Fula. Public health official yena meli alon ko kumayata bake bare kabiring ite alon public health might be the backbone of health ya faham yal bare kabiring corona keta jambe ajel la bele soronda itolle keta nyaton kuldi kadum huwa kono dawda ibola kabrama manda itollo itol yela mamma ko kaytandi ko ndol fanan sulata nyinela agreement o dara faketa ministry na sembo jayi kam bare ya jele ko be duma o mu ku kendol fo ku kendonde
but ni ko sembo jagan mo understand
sembolom kadini mo kacha sembolom ini mo kacha sembolom will you agree with me ko sembolom ini mo kacha dal d'accord da ko min benin kala make ye pare na kacha da ko denke primary ndu ko janna fo dara wod langoto rek ya suspend is that right
alan kam fo don don ni ajibe suspension ngi nar nyam nga fo ko be miscommunication
jumal la fold
no I mean you cannot fo nga si nga ajibe nga assess where the fault comes from, but the miscommunication occurred at some point. But this is the situation. It's a very unfortunate situation. But that's the situation.
Science and yala no bad control and bad and death registration amantara keka. Yolan. Yala no surveillance fana border surveillance health surveillance fana mantara keka. Yo fana lon. Airport to any disease sudu nyum disease kudo miyalon ko marbog. Disease me alon ko sandeng Ghana 2 cases is deadly 2 cases Ghana wala confirm Ghana West Africa kono jang surveillance je fenti je men satina no ngol fight against nyame ngol be mandara ke Gambia is at risk right now
negotiating for that coming back
yala no komi wo fana mbije yala no ko komi there is no environmental health inspection both for liquid and solid waste wo bebe caring will be laring cool kon me alon ko science and dingi mantara keka and a lot more of things me alon ko public health official le keke so it's like the country is at risk right now and it looks like the government is not ready to do something about it.
The government will listen.
But why is the government not listening?
The government will listen.
The Gambia is at risk right now kuran nata na ngabe dungal because melu nyanta dola wodlang to kaje ko nyun kurang
As I speak to you now, the National Assembly today, I mean information on the executive command at the National Assembly. I think the plan is also to engage the Minister of Health. So Kachal be on. I'm so in suspension.
So but sign.
But Kachal
be keka on. But sign. I was made to understand during my research the Ministry of Health is planning purka every health facility kanos fula bonde ye karu purka nyula duko.
That's the plan.
And they will be trained for I'm on top of things. They will be trained for 1 or 2 months. Purka nyula duko. Is that correct? No. Yes, in this work on. Banko bedame is at risk. Kuran nara dunanya. Ime mire bol fela na nyamali kacha ko modol le recruit la purko dogo.
No recruitment mo fanan kacha kachal be on.
Is that correct?
No kachal be on. But me
is that correct njai?
No, okay. Every cadre na own training schedule. The public health official give the government immunology. It's a special model that every public health official must do. And there's also immunization you must have to do, mode of immunization, the administration of the vaccines and so on, keeping the vaccine. You must have to read that. And this is one of the core subjects that if you fail that, you cannot pass through the school of public health. It's a very tough area. And that one you do it more than I would say more than 6 months. So, and that's it. And then coupled with continuously every time you are examining on that one. It's an area it needs specialization. So right now we are still negotiating and discussion be on.
But if discussion is on, why do you have to have this idea.
No,
Pur kan no solta ka train can you lado ko ke?
Coming up with everybody in our own specialized.
It means they are trying to whip them more.
No, it's okay. We'll sort this thing out. Because I'll be caring. Let's not preempt.
And I know you will agree with me. Gambia is one of the top countries in Africa when it comes to immunization.
We are above.
When it comes to immunization,
for so many years,
coverage. Gambia is on top.
Yeah.
But don't you think is going to dent
our coverage will be affected? That one is true. I agree with you. The coverage will be affected. Because we always
yet the government is not doing anything about this.
98%. It's always like between 90 and 98%. Always.
And the government is not doing anything about that.
That's why
COVID-19 certificates are not being given now.
No, yeah, they are given. They are given.
But it not give la nyawe man
No, because like if some of them they will not be vaccinated. Like what I'm calling a vaccination. Okay, let's vaccinate.
I don't want you to deviate. Ha.
Some of them they don't get vaccinated and they yet still they want to get a certificate. What is possible now? You must have to get vaccinated. You get the card and also with a copy of your passport and also a telephone number.
But Melbourne do ko kera ni always serious work on abekero.
That's available.
Jumale bodo ko keka. Almost half of public health officers.
That one is centrally located. That one. That one I don't agree with.
Okay, but
EPI is handling that and EPI is at the center.
Mambala wala. COVID fango public health officer. Atadal for more chemical on doing thing.
Yeah, we are about
public health. 900 plus.
Yeah.
So 371 you're almost a half. Yeah, understand.
But these are the key people are living at the health center.
Yeah, faham ya. So Neo all Cindy, it am remember bango put at risk.
No,
that is what the ministry is doing. The ministry bango sambala at risk. Kuran nada be dunale.
No, inshallah.
It's on the jail.
No, but we will definitely.
It's on the jail.
No, it will be sorted out.
No, I'm asking you, Sonda jail.
No, see, the thing is.
I'm asking you a simple question. Kuran nada nan sai. Most especially in new deadly disease called the Marburg virus. The
personnel are not there to monitor and
but they are not there.
Yeah, that's what I'm saying. We are trying to negotiate to see.
Negotiate how? I'll be miracle can no so dolphin instead of settling this problem.
No, these are not nurses, but we have some contingency plans also, which is not necessary.
How long is the negotiation going to take?
The negotiation is on, and also we also put on a public health contingency plan.
Are you giving assurance because suspension is going to be lifted?
I'm not sure of that yet, but I cannot give you that information now. But I'm sure we are discussing it.
So it's like the government the Ministry of Health doesn't really care.
No, the Ministry cares.
Of course, that is the conclusion.
No, Ministry cares.
Melbe do ko la health position do kaje ko disease ning kudol surveillance ning everything me along ko is it has something to do with public health.
Yeah.
Umantara kekang. Yet the government is neglecting that they are comfortable to see those things happening.
No,
is this correct?
The government is doing something about it.
But what is the government doing?
The National Assembly called them. And the National Assembly is going to do that on that process. And the National Assembly is also part of government.
Well, the Gambia is at risk right now. It's clear. So I will leave it at that. So let's jump to something else as important as this. COVID-19. Kabra nata Gambia. Ministry of Health made millions. Kodomin Ministry of Health Kodomin doku COVID-19 go million. I will tell you.
Okay.
How? Testing naka kenu. COVID-19 last starting in 2020. Testing naka kenu 5,000 laka jok. As from point ajida. Adu alala lungo molbe testing la pour ka travel. Isonta la ko million le do kuta wodo.
Well, that for exact figures because I'm not part of the accountant. I'm not the accountant.
I'm not denying that, but you don't need to be an accountant to agree with me ko million le do.
No, but really I can only talk about things that I know of.
Mr. Njie. Isonta la ko million le do kuta. Kabirin 2020 5,000 old jota. Motor 2005. Hani bi wobita kan kabirin 2020.
Sure.
May 2021, 2022. Sanjifula.
Yeah.
Sanjifula. You don't need to be an accountant to know million le dunta water.
Well,
so if you want to deny ko or you want to have a back and forth there, that will not be essential. Let's get into the team proper. Now let me.
Because one, I cannot tell you how much is in. Because I am not in the middle of the people. I'm not.
But I can tell you.
To the bank, EcoBank. That's what I'm just giving it on.
Yes.
And then receipts are collected at the National Public Health Laboratory.
Okay, I respect
so that one. I definitely.
I can tell you million. I can tell you not only million.
Okay.
Comfortably.
Okay, good.
I can tell you million only dunta.
Okay.
COVID-19 test certificate pour ka so test case certificate o la pour yatama million only dunta man sakundai.
Okay.
O safetale o belare Also fana kodo men dunda kabirin COVID-19 nata asia battle. Isonta walale. Different donors. Yeah, exactly. All nata. In fact, $160 million. The Ministry of Finance already Ministry of Health for COVID-19 la quote. You remember that? Do you remember that?
You see, when if you don't
no, I'm telling you, if you don't remember, I can let you know.
No, when it comes to finance, I'm definitely a layman in that area because I don't deal with financial issues.
I'm not asking us to take a calculator here. I'm telling you basic things.
There are people who handles these forms, and really, I cannot give you any information.
Okay, I'm coming. Yeah, you don't need to be an accountant or to work with the finance department or whatever.
That is if we are working directly with the form. I cannot tell you how much comes in from where.
Even junior citizens, no. I'm sure they are privy to this.
No, that's okay.
Health to kodo men kadunje Gambia jam ministry tije men ka akadundame. So sa lafta mello na wole mjindi ko nyin COVID-19 test kodo akadumi. Aliyemu plan le soro pour nyin kodo la fanna.
Well, I cannot give you any information because my information is all about it. As to Abekalaminti, definitely from the Mal Abekalaminti.
Akakeminti fan Almar.
Well, I don't have any. Maybe the National Public Health Laboratory, the director of the National Public Health Laboratory, will consult. If I get the information, what plans are there, then how long I can.
Yeah, I don't know.
No. Seriously, you know me, I'm very franco. I will tell you what I know of. This money Abekalaminti in Tafon.
But Sila, you million will be kadu. International organizations like WHO, William million already. World Bank million already.
World Bank min keda ngo jele.
Ya fam ya.
Wolte
banna. Donol mba kontila janne. Donol mel kana nafulo men kadung health. Abuka dum ministry to Gambia kono jang.
Okay.
I can tell you this for free. No so wokodo saying akadum mi.
Ne ngi ngale ben jakan lal. To nyaado ya. Don't frankly speaking ben jakan lal. Because I don't know where the money goes. Because the thing I cannot tell it, I know all the monies are paid, and there's a central location of that. There's a treasury, so I don't know which of the accounts in treasury.
Yeah, will you agree with me? Kudo min beka don helto. We bankola jada kende abunda sambala next level.
But look at the structure.
But it's not no number ngana. I couldn't even kambe jaka.
Now look at the structure.
I'm coming with all these monies coming in. Hani bi Gambia mantra takano. And critics are saying ko.
But look at the ambulances. I'm coming. 80 ambulances.
I'm coming. You are quick to talk about the achievements.
Yeah.
I'm coming.
No.
Critics are saying ko. The Ministry of Health. Ranging from the first person, Dr. Samate, to the last person, you have failed Gambians woefully. Will you agree with me?
That's what they said.
That is what critics are saying. Will you agree with me?
No, I don't agree. We didn't fail anybody. We can also criticize them also for other things. Because as I told you since day one, there's no person, no country that can.
But kudu nafulo min be kadun Gambia la health. Abukata ministry do. Ngalla moile. You don't want me to talk about what is happening.
But the thing is, I only tell you what I know of it.
But nafulo min be kadun health. Iko e malon kodo kadun dam.
Well, I cannot tell you exactly about that. Because I cannot tell you. I cannot. Because I'm not.
It's a pleasure receiving.
Thank you
very much, Mr. Njie.
Thank you.
Do you want to be a professional driver? If yes, worry no more. Send Driving, the finest among all, is here to turn you into a first-class professional driver. We are the Gambia's numero uno solution when it comes to driving. Send Driving, we offer top-notch and affordable services that cannot be found anywhere. Rush now and start getting your lessons from our competent tutors. Send Driving. Our services include 1 week driving lesson, 1 hour each day for just $3,300 with a provisional driving license, 2 weeks driving lesson for just $5,000, 3 weeks for $8,000, 4 weeks for $12,000, and 5 weeks for just $13,000 with a provisional driving license. We are located at Tabokoto, opposite Piccadilly Junction. Send Driving, your success to safe driving.
Yaye money transfer ilelanna yata itole sono yata kodo dunni yaki te koduna karobela banko karobela katom okoina benyindulala UK ning Ireland Europe kata Africa aning America na office oli benyindulala nyindulala sera Serekunda woni talinding tabo koto woni mbusumbala burusubi kataba kote tujeren woni nakunju katong katabati birikama ba katafo kerewan para fe katafo kawu alisala kodota jiti bankolito woni mfana Dross bankolito it cash power go fanankali yenne mobile topo go fanankali yenne iredi go bata woni ndibo banta ni la vida lon na fana yaye ka kenyaming ibunyin julola yaye ka kete ifele www.yaye.co.uk waranto ise bunno julola +440208519007 waranto 07930957 and in fanang ila customer care member America ise bunno julola 001781215377 yaye nyulela